Welcome to Glencoe's Health eSpotlight video series, where real-world connections help you develop the skills for a healthy future.
When it first came on the market in 1946, penicillin was considered a miracle drug. Now, doctors say it no longer works against gonorrhea and can barely treat a child's ear infection. It's one of many once powerful antibiotics rapidly losing its ability to fight infectious disease because of drug resistance.
We are literally in a race against time.
The World Health Organization issued its first major report on the topic, a call to arms of sorts to rethink global use of antibiotics now in order to avert a coming catastrophe.
Up to 40% of all tuberculosis strains are multi-drug resistant. That means they resist all the drugs that should be used for initial treatment, for curative treatment of tuberculosis.
In developing nations, drug resistance stems from underuse or improper use, people taking whatever they can, whenever they can get it. In wealthy industrial nations, the problem is overuse, people popping readily accessible antibiotics for whatever ails them.
Patients have to stop stockpiling them and demanding them. Doctors have to be able to look the patient in the eye and say, "You've got a cold. You don't need an antibiotic."
Half of the world's antibiotics are also used on the farm, producing healthier livestock, but at the same time creating drug-resistant strains of food-borne bacteria like E. coli.
Every bacterial agent has learned over the last, not so long, 50 years, to resist the most potent of our antibiotics.
How often a year should we be checking our medicine cabinet to look at the dates?
Well, you should do it a couple times a year, but you must do it once a year.
Right.
And the end of the year is a great time to do that. Start fresh, take out the old stuff, get rid of stuff you're not taking anymore that's beyond its expiration date. Start fresh for the new year.
All right, one of the things that really comes to mind, because a lot of us keep these bottles of prescription medicines, we kind of store them
Hanging
away
on
in
to it,
there and
squirreling it away.
Yeah, should we just get rid of these?
Yes, you should, because doctors write these with a very specific time frame in mind most often. People who are on chronic medication, who should be taking it on a daily basis or in some routine way, these medications are not intended to be sitting around. So if it's a prescription medication, particularly something like antibiotics, which I know lots and lots of people squirrel away for that day when they think they might need it, that's a mistake.
And because you're supposed to take them for the full term,
that's
right? And they should be done.
That's
they should be gone.
Absolutely. And some medications like insulin or blood thinners, it's very important that those are current and up to date.
All right, get rid of all of that.
Get rid of those.
But
if you're not taking it, get rid of it.
But look at all of these. Here's all kinds of aspirins and antihistamines and different things. All of them have dates, although some of them are almost
so hard to read.
Unreadable.
I can barely read that.
Yeah, so what do you do about that?
Well, obviously, check all these. You know, it's a shame to buy a big bottle like this and then throw it away. So if you're not someone who uses these over-the-counter prescriptions routinely, buy the smaller bottles. You'll feel less bad about throwing it away when it's beyond its expiration date. You'll waste less. But obviously, if it's past its expiration date, get rid of it.
There are a couple other things, though. Here's some Caladryl and some other kinds of things. Should we worry about dates on stuff like that?
Yes, gels and topical ointments.
Really?
Those often have expiration dates. You should look at those. Yeah, everybody has a roll of tape like this that cracks when you open it. It's so old. I mean, so get rid of that stuff, too.
Here's my question, though. If we're getting rid of this stuff, do we just throw it in the garbage, or should we be a little more mindful about what we do with it?
Yeah, let's be mindful. A lot of the stuff is not good for the environment. Pouring it down the sink or flushing it down the toilet is not a good idea. Some pharmacies have give-back programs, not all, though.
Wow.
If it's a medication and you have a toxic waste site in your area, you can wrap it up and take it to them.
Wow.
If you don't, you should wrap up the bottles. You can close them with duct tape, put them in a plastic bag, and make sure they're in a place where children can't get their hands on them and throw them in the garbage.
Wow.
Also, I mean, this is a really important point. We have medicine cabinets in the bathroom, but that's probably not the best place for many medicines.
They're always said to be kept cool and
Yes,
dry,
cool,
right?
dry, and high, because you want them away from kids.
Right.
So most medications, if you have a linen closet or somewhere where it doesn't get hot, warm, and moist, like in the bathroom, that's probably a better place. And keep it away from kids, obviously, at all costs.
I never would have thought of that. Thank you, Emily.
You've been watching Glencoe's Healthy Spotlight video series. Remember, be healthy, choose wisely.